how do you now see GIS being able to be a beneficial tool for epidemiology and health crises?
It's a very important tool, right? So the thing about GIS is that, and that was the thing that attracted me when my boss asked me if I wanted to join the company and lead the public health team. Because I'll be honest with you, I had never encountered GIS as a discipline. I've always looked at maps. I've always loved maps, and I've always seen maps in the context of my studies. Right? Everyone has seen disease prevalence and disease incidence maps. Are you familiar with those terms?
Yes.
So everyone has seen those maps before, but I never thought about the fact that this is a discipline in itself, that this creates tools that can help health decision makers make better decisions regarding health, both population health and clinical medicine. So when I came to HSR for as an intern, that was like my first time seeing this in action, and I was like, man, this is a powerful tool, and it kind of opened up this kaleidoscope of uses, of different uses that, of different industries in healthcare and public health. And I was like, man, this is very interesting. So when he asked me to join, I joined primarily because of that, because I felt like this is a way to do what I want to do, which is global health, but this is a tool that's very actionable. This is
Mhm.
something that can be used. I personally am very big on field, something that works in the field. A lot of people are very theoretical. I like theory, but I don't think it's important. I think more important is, will this help someone? Can this
Mhm.
be used in the field? Can an epidemiologist in Uganda use our GIS tools to do their job in a better way and save more lives? So that was kind of the promise. I thought, my personal opinion, it was like, yes, it can. That's why I agreed to come and join the team, right? And I haven't been proven wrong yet. I've been proven more and more right, because our tools are very, very useful for a variety of ways, right? In a variety of ways. And so that's I guess what I'm most proud of our work is that it's not just some theoretical highfalutin, thing in an ivory tower. It's an actual tool that can help save lives. So I
Yeah,
like that.
and it's like you said that I think a lot of times, not even just in this industry, but in other industries, you have an idea and it's really big and grandiose, but the practicality isn't there.
That's right. Yeah. So I like
Mhm.
that. So for example, like when I came in as an intern, what we were working on, we had just been the World Health Organization had just brought us in to help them create COVID-19 risk maps for sub-Saharan African countries. If you
Mhm.
remember, in the fall of 2020, the COVID-19 pandemic was raging in full, and there was a lot of fear of what would happen when it hit Africa, right?
Mhm.
Because it had come out of China in December 2019 and hit most Asian countries in the spring, in the United States by April or May, and Europe in that summer too. And it had collapsed health system, right? If you remember, Northern Italy's health system completely collapsed. New York City was about to collapse. So people were like, in wealthy countries, look at what this disease is doing. What's going to happen when it hits a poor country, a resource poor country, like in Africa? So the World Health Organization, to their credit, which, I don't know if you know much about the World Health Organization, but they're famous for being very slow moving, very bureaucratic. They're always the last people to
Mhm.
show up. Kind of that's the joke, in the public health field. But rare moment, I guess, of proactiveness, they said, let's help African countries plan for this, before the disease hits them really hard. So that's what we were engaged to do. They asked us, can you use GIS to create something that helps them prepare? So we said,
Mhm.
yes, we can. So what we did is, for 16 sub-Saharan countries, we we created maps for each one of them that delineated uh, transmission risk, hospitalization risk, and mortality risk. Basically, telling them, when COVID hits your country, these are the areas that are going to have X risk. So for transmission risk, for example, if a country has, I don't know, 7 provinces, we would calculate using a variety of factors, right? We looked at multiple things. We looked at age cohort, right? Because as you know, the older you are, the higher your risk of getting severe disease from COVID, right? We looked at things like healthcare resources, distribution of hospitals. We looked at a population density. We looked at movement of people, right? Because for transmission, the more dense a place is, the higher the population density, the higher the risk of transmission. Likewise, the lower the density, the lower the rate of transmission. So if you want to compare two different provinces side by side, the province that has the higher population density, almost by definition, will have a higher transmission risk. Now, they may not have the higher hospitalization risk because there's a different set of factors that affect hospitalization. In fact, the other province might have a higher hospitalization risk. And neither of them might have a high mortality risk because it's yet a third set of factors that influence mortality, whether or not you die if you get COVID.
Mhm.
So that's why we wanted to do 3 maps for every country, right? So we would do this. So for every country, we would delineate exactly, okay, when COVID hits, these are the regions where transmission will be the highest because of these 37 factors that we've mapped out, that we've calculated. These are the places where hospitalization risk is going to be the highest because of these 24 factors that we mapped out. And these are the places where mortality is going to be the highest, where more people are going to die because of these 11 factors that we've mapped out. Plan accordingly. So that was the hope, was once they had this, they could be like, okay, we can prepare now, you know, because that's one of the things that GIS is very powerful for, right? There's one core thing that I would say that GIS in public health provides is number one, it identifies vulnerable populations. It shows you where are the people most likely to die, to suffer, so that you as a health decision maker or a policy decision maker can make strategic decisions for resource allocation. Because you are never going to have enough money to treat everyone in a country or a state,
Mhm.
right? Let's say Virginia. Virginia has 36 health districts, right? If COVID-19 hits Virginia and there's a desperate need for vaccines, we have to vaccinate as many people as possible. The public health authorities of Virginia are going to be like, do we have enough money to vaccinate all 36 health districts? And their budget person will invariably say, goodness, no, we have enough money to vaccinate 10. So that public health decision maker has to make a
Mhm.
decision. Where do I deploy my scarce resources? And that's where GIS was very, very useful because we can identify in Virginia, for example, and we did this, by the way, in Maryland. We can identify where the risk of transmission, mortality, and hospitalization will be the highest. So that in those 10 places, we can identify the top 10 places that you can put your resources in.